Hello, we're going to talk about oral manifestation and oral care for diabetic clients or patients. We are students of dental hygiene at Southern Ontario Dental College. Our names are Paola Aguilar, Carolina De Fijac, and Carol Gonzalez. Diabetes mellitus. As we know, this is a disease which is part of a group of metabolic diseases characterized by hyperglycemia, which is high blood glucose levels, which affects immune system capacity of response and delay healing of tissues. We have type 1, which is insulin deficient, type 2, another type which is gestational, and type 2, or also known as insulin resistant, which takes about 90% of the cases of diabetic people. In Canada right now, more than 11 million people are living with this disease or prediabetes. Common signs of oral diabetes.
Okay, so my name is Paula. I'm going to continue with the presentation. Xerostomia, dry mouth, can be due to certain health conditions such as diabetics, oral infections, or due to autoimmune diseases. Snoring and breathing with your mouth open also can contribute to dry mouth, as well as tobacco and alcohol use. Xerostomia can lead to markedly increased dental caries, especially in the cervical region. On diabetic people, the elevation of glucose levels enhance the supply of sugar to the oral bacteria, causing caries rapidly. Fruity acetone breath occurs when a person is in ketoacidotic state and is close to a diabetic coma. Immediately, we have to send it to the medical emergency. Refill is indicated. Metallic taste can occur when use of the oral hypoglycemic drug such as metformin. According to the National Kidney Foundation, up to the 40% of those with a type 2 diabetes will eventually suffer from kidney failure. Medical notes say wasted buildup in the kidneys can result in a bad breath or loss of appetite, causing a metallic taste. Oral manifestations of poorly controlled diabetes. One of the effects of diabetes is the delayed healing of tissues and delayed immune response, which results in a high susceptibility to oral infections. The most common are oral candidiasis, known as thrush, angular cheilitis, and mucositis. Among the risk factors are use of antibiotics and corticosteroids, xerostomia, ill-fitting dentures, malocclusions, and smoking and inadequate oral care. As well as the oral manifestation, we can see white plaques in the buccal mucosa and under the tongue. Refer to the DDS for a consultation immediately. Denture stomatitis is another type of candidiasis when dentures are present and warm for a long time. Clinical features are redness and inflammation of the mucosa, no painful lesions, and rare complications are angular stomatitis or papillary hyperplasia. Glossidia, burning mouth syndrome, and medium rhomboid glossitis, glossal central papillary atrophy may occur in addition to burning mouth symptoms associated with diabetic neuropathy. Median rhomboid glossitis etiology is unknown. It is most often thought to be a congenital anomaly or a chronic localized candida infection. Papillary hyperplasia is caused by a poor oral hygiene and wearing dentures 24/7, long periods of time. It's a benign oral lesion treated by removing the tissue growth done by the dentist. Recommendations are good oral hygiene, including denture cleaning and soft diet. Periodontal disease process is excessive bone loss, tooth mobility, early tooth loss, rapidly progressive pocket formation, gingival bleeding, and subgingival polyps. Overall, periodontal disease is more severe and more frequent in persons with a poorly controlled diabetics. Gingivitis is reversible. It's a mild form of gum disease that can usually be reversible with a daily brushing and flossing and regular cleaning by a dentist or dental hygienist. This form of the gum disease does not include any loss of bone and tissue that hold the teeth in place. Periodontitis is irreversible, also called a gum disease. It's a serious gum infection that damages the soft tissue and without treatment can destroy the bone that supports your teeth. Periodontitis can cause teeth loosening or lead to the tooth loss. In this picture, it shows the periodontal disease process from gingivitis which is a reversible condition to a periodontitis which is irreversible condition. Poor oral hygiene can lead a diabetic patient to experience periodontitis.
In these pictures on the left side, we can see how excessive bone resorption has been caused to periodontitis. And on the right side is the clinical appearance of a person who has experienced tooth resorption. Another feature that we commonly see on diabetic clients is enlargement of saliva glands, specifically parotid glands, which are located on right and left side of our face. And it is a bilateral enlargement. This is asymptomatic, and the swelling of these glands can increase saliva viscosity, and it will lead to changes in the periodontal tissues, oral mucosa, salivary gland function, and oral neural function, and increases the risk of caries. Oral self-care and recommendations for diabetic patients. Stillman technique manual toothbrush is recommended, and here's a video of this technique.
In this video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
Another toothbrush that we can use is an electric one, and it is recommended to prevent traumatic toothbrushing. No pressure is needed, so we're going to let the brush do the work, as well as the manual. 2-minute brushing is recommended to effectively remove plaque. Here's a video of the technique used.
Oral-B oscillating rotating brushing instructions. Wet brush head and apply toothpaste. You can use any kind of toothpaste. To avoid splashing, guide the brush head to your teeth before switching on the appliance. Move the brush head slowly from tooth to tooth along the gum line, spending a few seconds on each tooth surface. Brush the gums as well as the teeth. First the outsides. Incline the brush head so the bristles could reach into dental areas. Then the insides. And finally, the chewing surfaces. There is no need to brush hard or scrub. Let the brush do the work. More advanced models of Oral-B power brushes have a gum care pressure control system that alerts you when brushing too hard. Remember, spend 30 seconds on each quadrant of your mouth and brush your teeth at least 2 minutes twice a day. For the best results, dental professionals recommend to change the brush head regularly every 3 months. The #1 brand used by dentists themselves worldwide.
Another aids that we highly recommend our clients is the use of a tongue cleaner, because plaque just get in every surface and every possible space in our mouth, and the accumulation of plaque on the surface of the tongue can lead us to bad breath as well. So it's important to remove it. This type of tongue cleaner is from the brand Gum, and it's about $5.29. We also recommend the use of floss to clean in between our teeth. And if it's not possible or it's really hard to use the regular floss, we highly recommend the use of interproximal brushes. There are different brands in the market, and the only thing that you have to do is put it in and out in between the spaces of your teeth. There are also dental care specialized over-the-counter products. These are highly recommended for clients who are highly susceptible to develop decay or experience dry mouth. The first one is a mouthwash without alcohol that contains sodium fluoride. This one costs around $6.99 for 1 liter, and it is important to use, it's enough just to use 10 milliliters of it for 30 seconds and then spit. Another type of mouth rinse that we recommend for people who experience dry mouth is Biotin, which moisturizes your mouth. And you can find this at the drugstore, and it costs around 13.49 for 47.3 milliliters. Another type of mouth rinse recommended is Opti-Rinse. You can also find it in the drugstore. The active ingredient of this one is xylitol, which reduces carcinogenic bacteria load, and the tooth decay causing bacteria are not able to metabolize xylitol, which results in absence of lactic acid and polysaccharide production. So this will promote saliva and protect you against caries. The cost is around $20.99 for a liter. And another toothpaste that is highly recommended is Prevident from Colgate, and this type of toothpaste contains a high concentration of sodium fluoride, and it costs around $12.29 at the drugstore as well. It is highly recommended after brushing your teeth. Do not rinse with water or mouth rinse to let the fluoride of the toothpaste act in your mouth. And the other product that we recommend is gum without sugar. Instead, the active ingredient is xylitol, which is a natural sweetener. Will promote saliva and protect against caries as well. It costs around $4 to $5 each bag, and it contains 55 pieces. You can find it in HomeSense, Winners, or healthy stores. The important thing to say to our clients is that xylitol is harmful to pets, so it's better to keep it safe and away from our pets.
Now we're going to talk about some alternatives. There are some situations that we need to use some oral self-care alternatives when we don't have handy a toothbrush, dental floss, or toothpaste. Alternatives such as clove soap in water or mouth rinse, length of thread or cotton instead of dental floss, as well as salt or baking soda can be used as substitutes of toothpaste. It is important to mention that salt is not recommended for those individuals that experience high blood pressure. Carcinogenic and non-carcinogenic foods. Carcinogenic foods are high content of sugar and carbohydrates. Sugars are fermented in the mouth for effect of the saliva and plaque biofilm. Anti-carcinogenic foods are foods low in sugars and carbohydrates, so that means that a healthy diet, avoiding this kind of food, will help us to keep preventing caries. Denture care is another recommendation for a healthy mouth in diabetic patients. Adequate denture care can prevent oral disease in diabetic patients. It is recommended to remove dentures from the mouth during nighttime in order to let the tissues rest. Clean the dentures daily with a brush and soak them every day in a denture cleaning solution. If the denture has metallic parts, don't use any solution that contains bleach. Instead, use mouthwash once a week, only because it can stain the denture. Now we're going to talk about oral cancer screening that is recommended to perform once a month. Oral cancer screening performed once a month in order to detect early suspicious lesions. The picture shows in all the areas that we can examine when performing oral cancer screening. These areas are the most common areas that suspicious lesions can appear. When an oral lesion is present that remains more than 2 weeks, should be monitored to identify changes in evolution of the appearance, size of the lesion. Using the ABCs of the dental oral cancer screening is very important. Looking for asymmetry, borders, color, diameter, and evolution of the lesion. When there is present a suspicious lesion, a referral for a dentist or the dental surgeon is recommended to evaluation, diagnostic, and treatment in the future. We are
very thankful to the Diabetic and Food Care Products at Compass Healthcare Center for your support and help to delivering this educational program. Thank you so much for your attention and your time.